We based our staffing projections on two of the local Comfort Care homes, on these two Comfort Care homes, my apologies. Hospice, and I'll cover this in just a second here, hospice provides overnight nurse services, and that the Comfort Care home needs to supply about 70 volunteers a week when there are two people in residence. And that their staff, their paid staff, amounts to essentially one paid full-time equivalent divided into two positions, two part-time positions. Let me just make a little distinction here. We're talking about putting in a Comfort Care home. There's many good reasons why we have to limit it to two people. There's a borderline here between turning this into a full-fledged medical hospice and a Comfort Care home. The regulations are far less onerous for a two-bed residence. And that's all it is. Now, there are medical hospices, most notably around here up at the Park Ridge campus. They actually have a hospice, and there are a couple others around. And that's an 8-bed place where they actually can provide a higher level of care that we aren't anticipating doing. This hospice insurance coverage that you get is part of your medical insurance. It does not support the actual place for a Comfort Care home, but it supports the medical needs of a person who is actually in residence. Can we get that many volunteers, though, is the question. 70 a week while we're occupied. We started out with how far away the parishes are over in Five Saints West, and it's about 11 miles or so to St. Vincent's as the crow flies, which is the furthest away. Put a little map together. That red dot in the center that's hard to see is the center of the known universe, exactly where you're sitting right now. And if you see, it goes all the way up into Greece and over toward Leroy and encompasses quite a bit in area. We did spend a little bit of money, the seed money, getting some reports from a company called Demo Reports, who takes U.S. Census data and some other input and puts it into a form that we asked them to put it in. In this 12-mile radius, there's 100,000 households and 65,000 families and over 250,000 people. If you do the math, to get 100 people in a week, we only need one out of almost 2,700 people in that area. But we have a head start on that. From the survey, and people could fill out multiple categories, we had people check off these particular things that they'd be willing to help us with. And also, I'd like to note right now that about half the people who said they weren't sure this was an effort we should look into or said no, volunteered to do something should we go ahead, which I found absolutely stunning. And this is the question that popped into my mind when this first came up, is how do we get enough money? Well, as part of Mark's efforts doing research, we found out that these particular homes spent somewhere between $100,000 and $230,000 in a year. The reason that Teresa House spent so much, and this is not their operating budget, this is just what they spent in one year. We didn't do a rigorous audit. We just said, what did you spend last year? Well, they had a lot of contributions that year, and they did some upgrades and that sort of thing, so they spent the money that they had coming in. But we're anticipating that our budget will be somewhere around, operating budget will be somewhere around $100,000, maybe $120,000 a year. Now, those income sources are fundraisers, donations, bequests, grants, but that money, as I was alluding to before, doesn't come from people's insurance. And let me use the example of somebody's grandmother who's dying. If somebody decides to get hospice care, there's two issues involved. How the care is provided, the hospice care, which is typically through an insurance company or Medicare or Medicaid, something like that. And then there's where it happens, a home, a nursing home, a family member's residence, or a house that we're providing, the Comfort Care home. So there's no such thing really as hospice insurance. There's health insurance that has hospice coverage. That medical side of things, the drugs, the treatments, those kind of things are all provided outside the scope of what we would be providing. They would be provided in our facility, but they would be outside of our scope.